Welcome back to Midday Kentucky, everyone. There's a cutting-edge medical innovation for male enhancement called the Priapus shot, or P-shot, that's getting a lot of attention these days, and the procedure uses the same healing power of PRP often used by athletes, except to enhance sexual performance. Dr. Barsha from the Anti-Aging Institute is here to talk all about this highly successful, non-surgical, drug-free treatment for erectile dysfunction. Welcome to the show, Dr. Barsha.
Hello, Troy.
Okay, let's talk a little bit about, to begin with, who are the candidates for the P-shot?
Anyone who suffers from erectile dysfunction. So it could be just a start, or you could be using medication like Viagra and Cialis and they stop working for you. After prostate surgery, people with diabetes or high blood pressure who are having a hard time achieving, or, as I say, anybody who's having a problem in the sac.
Okay, so let's talk a little bit about the PRP service to begin with. We're going to bring up an image, and we just want to explain to everyone how this process starts to begin with.
Correct.
So let's bring that up. Here we are here. Explain to people how it's used.
So we just take your blood similar to when you go and get your cholesterol check, and then we have a special separation process, and we put the blood into, and that will give us the plasma-rich platelet that contain platelet, which are the healing factors, plus all the growth hormone and the activator.
Okay, so let's get to the next one. How is this procedure done?
Well, it's very, very simple. We give a topical anesthetic, sometimes a local block. Also, for people who are extremely anxious, we provide something called Pronox, which is a mixture of oxygen and nitrous oxide, which take away any pain or anxiety. And then we inject that PRP into the male member, 5 injection, and people will say, ouch, that gotta hurt. Just to let you know, I was doing somebody last week, and I walked into the room and I brought the anesthesia, and he said, no, I don't need that. I said, what do you mean? He said, I had it done before, and it was nothing. Okay. And he had it done without anesthesia, without gas, without nothing. I said, wow, this guy is a male. He said, really, there's nothing to it. Yeah. It's just more of a psychological thing that said, I'm getting a shot.
Okay, so let's talk through that process. We all know what Viagra is used for.
Correct.
So is this someone, let's just say, because they say you can't really use Viagra if you have a heart condition?
Well, that's the beauty of this treatment. It's a one-time treatment. You don't have to worry about a timing taking a pill, or if I take a pill, may not get lucky and it's going to go away. They are expensive.
Yes.
And they have a lot of drug-to-drug interaction, and eventually they'll stop working. So this is something from you back into you that produce the same result, because the idea behind the PRP, when you inject it into the correct area, it will enhance blood flow to the male member to cause a lasting duration.
Okay, all right, okay, so I understand that part. I think it's really important also to ask, how often do I need to do this? Because we all know Viagra is used when you want to have sex, of course. Right. Now, is this something I have to do all the time?
No, just you come in and say, you have your shot, and then usually result within 4 to 8 weeks. So that 8 weeks, this is the peak benefit from the medication. It will last you for years, depending on the condition that you needed the shot for. Depending on how, if you're treating your diabetes correctly and high blood pressure correctly, or just the aging process.
So, and here's the thing also, and we had this conversation off camera that it is a difficult topic to talk about.
Correct.
But, there's a lot of men out there that have issues.
Correct, men and women. I mean, you mentioned men, but there's a lot of ladies who are having a problem because their significant other is unable to perform. A lot of time I had the lady that ask the question because the male are kind of shy,
nervous,
or they feel less masculine to talk about it. Well, guys, it's going to happen. So as we age, our bodies deteriorate, and this is one of the things that also
why not? Everything else we can take care of
right.
at the Anti-Aging Institute.
That's
Let me tell you about that. Okay, everyone, we have a great promotion out there that Dr. Barsha is giving everyone. If you just want to go over and have a consultation, and you get 20% off the P-shot, give them a buzz. Here's the phone number and the address also. You just mentioned Midday Kentucky, everyone. You get 20% off this procedure. There it all is there for you right now. Antiagingky.com is the website. We appreciate you coming in again, Dr. Barsha.
Thank you.
I'm looking forward to hearing the results that you are doing over these next few months.
So far it's been very, very promising.
Good. That's what we like to hear. Up next, everyone, Star Wars fans, jump for joy as The Last Jedi is released on home video. It's Midday Kentucky, everyone. Plus, we've got a little bit of Madonna.